Hi, I'm Keaton Oglesby, and I'm reporting on Lyme disease. So when I first thought Lyme disease was an option, I chose it as soon as I could because I know quite a few people who have suffered debilitating effects from Lyme disease in the past, and also I was diagnosed with it this summer. So I've been treated now, so I'm okay, but I was just super curious and wanted to learn more. So history. Lyme disease is also referred to as Lyme borreliosis because of its causative agent, which I'll talk about. It was first recognized in the US in 1975. And it was discovered because in the early 1970s, Lyme, Connecticut was reporting an abnormal number of children with arthritis. So investigators went and they found that it was actually caused by an infectious disease. And they also found that the black-legged tick was the vector responsible for transmitting it to humans. And while it was first recognized in 1975, researchers found reports of similar symptoms in Europe from early 1900s, so it's been speculated that Europe is the source of America's infection. So what causes Lyme disease? Members of the Borrelia burgdorferi sensu-lato complex cause Lyme disease. There are about 18 members, and Borrelia burgdorferi sensu stricto is the most common species in the US that causes Lyme disease. A less common pathogen is B. mayonii, which was discovered in 2013. So some characteristics of Borrelia burgdorferi. They're spirochetes, they have linear chromosomes, and they're considered gram-negative because of their bilipid structure. But they actually exhibit some characteristics that aren't common to other gram-negative bacteria. Like instead of having lipopolysaccharides, they actually have immunoreactive glycolipids. And also their flagella are not exterior. They are found in the periplasmic space between their two lipid layers. They're also highly pleomorphic, so they're able to adapt and change their morphology based on their environments. Here is some general taxonomy and also the doctor who was responsible for discovering the spirochetes. It's Dr. Burgdorfer. So, epidemiology. There are approximately 30,000 cases reported annually in the US, but the actual number is estimated to be much higher, like about 300,000. And the reason those numbers are so different is that accurate surveillance is very hard to obtain. So, Lyme disease is very, very easy to misdiagnose. And also there's just a lack of reporting. And also, accurate surveillance can't always be gathered because the data is from the county of residence during diagnosis and not necessarily where the patient was exposed to the bacterium, so that can be hard too. Over here, you can see on the map, there are some light gray states. Some of them are covered by so many dots you can't even tell, but those states are considered high incidence states. And to be identified as high incidence, there must be 10 confirmed cases for every 100,000 residents. And in recent years, Lyme disease has been spreading into some neighboring states where it wasn't previously found. And some think that that could be because of climate change and change in the vector behavior. Lyme disease is also found in Asia and Europe, just caused by different members of the species complex. In Europe, there are approximately 85,000 cases estimated per year. And in a histogram below, you can see that there is a large influx in Lyme disease during the summer months. And that is largely due to vector activity. So Lyme disease is a zoonotic disease. So the reservoirs are mice and other small vertebrates. And then the vectors from the genus Ixodes, they feed on the reservoirs and then they start carrying the bacteria and they can transmit it to other hosts later that they feed on. So the two primary North American species are Ixodes scapularis, which is in the Northeast and Midwest, and Ixodes pacificus, which is unsurprisingly along the West Coast. The tick life cycle has 4 main stages: the egg, larvae, nymph, and adult stage. So down on the right, you can see the 6-legged larva, the 8-legged nymph, the adult male, and the adult female. The bacterium for Lyme disease is transmitted 36 to 48 hours after maintained tick attachment. So if you remove the tick before that time, you're actually much less likely to contract the disease. And then blood donors, question mark. There have been reports of the bacterium surviving in stored blood that has been donated, but there aren't any actual reported cases of Lyme disease caused by that. It's just recommended that people with Lyme disease do not donate blood until after their treatment. So populations at risk. Since Lyme disease occurs in endemic areas, people who live in those areas are much more likely to contract it. There are three major U.S. endemic areas: the Northeast and Mid-Atlantic, the North Central states like Minnesota and Wisconsin, and the West Coast, which is primarily like Northern California. And the 14 states of the Northeast and Upper Midwest region account for over 96% of the reported cases. So it's much more likely for people in those areas. On this table to the right, you can see that every age is susceptible, but children and older adults are more common. And it's also, there are slightly higher numbers among men than women. So prevention. Lyme disease is primarily prevented by reducing tick exposure because there are actually no human vaccines that are currently used. So one method is to just use preventative products and routinely check your pets for ticks. So dogs are particularly known for carrying ticks into human residences, and also they can have Lyme disease. So it's just important to always check to just reduce exposure. So over here is a picture of a dog and some of the most popular areas for ticks to inhabit. And then some techniques to avoid personal exposure when you go exploring. The key to this is just really reducing or minimizing your skin exposure. So it's recommended to wear long sleeves, closed-toed shoes, socks, and pants tucked in to your socks. So you won't be winning any beauty pageants, but you'll be much safer. And it's also recommended that you wear white clothes so that it's easier to spot ticks when they're crawling on you. You can also use insect repellent on your clothes and skin, though if you use DEET products, it's recommended to just use caution because those can have some side effects. And then another way is to just reduce tick population in ecologically safe ways. One main way is to just control the vegetation of your yard. So always mow the lawn because the ticks like to inhabit larger, like taller grass, and they like shaded areas. And there's also a study that was performed with pesticide-treated rodent and deer feeders, and it found that they significantly reduced the tick population of those areas. After 1 year, it was like over 80% reduced, and after 2 years, over 90%. So that was pretty effective. So symptoms of Lyme disease. Lyme disease, as I said, is very easy to misdiagnose because some of its early symptoms are very general. So 3 to 30 days after the bite, one of the actual characteristic, like major identifiers of Lyme disease is a rash called erythema migrans. It occurs in 70 to 80% of patients. So here's a picture. It's kind of known for being a bullseye shape, though it can manifest in other ways as well. Other early symptoms are fever, headache, fatigue, muscle joint and pain, and swollen lymph nodes. And without being treated, you can manifest later symptoms. So weeks to months after your bite, patients can show increased severity of some of the earlier symptoms, like they'll have a more severe headache. And you can have multiple rashes at this stage, so they can show up all around your body. And untreated patients, arthritis is very common for them. So about 60% of untreated patients develop chronic arthritis, and the knee is the most common place affected, which you can see here. Also, the bacteria can cause brain and spinal cord inflammation, Lyme carditis, which has had 11 reported cases of fatalities in the past 34 years. So that is a risk. And there's also studies accompanied by nerve pain and dizziness. So pathogenesis. Not a lot is understood about how the bacteria can affect the immune system, but it is known that it is highly invasive and non-toxigenic. So after penetrating the epidermis through the tick bite, the pathogens are inoculated in a hemorrhagic pool where they stimulate the inflammation, which is the initial rash. After that, the bacteria can be disseminated via the blood into target tissues like the heart tissue, the joints, and your nervous tissue. It is an extracellular pathogen, and it's thought that it can evade the immune system so effectively because of its ability to regulate its surface lipoproteins. So diagnosis. As I said, Lyme disease is frequently misdiagnosed, and it's because of its general symptoms in the early stages. So how is it actually diagnosed? Serologic testing is performed, and these tests detect antibodies and not necessarily bacteria. So since it takes time to generate the antibodies within the body, the first few weeks can produce false negative tests. The test is a two-tier test. The first is an enzyme immunoassay or an immunofluorescent, and if those results are positive or equivocal, it moves on to the second stage, which is the Western immunoblot. It can be IgG or IgM. And just this summer, actually, the FDA approved an alternative second step, which is just a second enzyme immunoassay. And also for patients that exhibit neurological symptoms, a spinal tap is performed to detect antibodies and also bacterial DNA. So treatment. Lyme disease is curable, but there's much more rapid and complete healing process if you catch it early. So people can suffer some long-term effects if their treatment is started later. And post-Lyme disease syndrome occurs in some patients who experience joint pain and a few other symptoms post-treatment, up to like 6 months after their treatment's completed. It's not really understood why that happens. Also, patients can be reinfected if they're bitten again by a tick and it transmits the bacteria. So also, sooner treatment started, the better. So oral antibiotics are for early cases. Amoxicillin and doxycycline, as well as penicillin, are common. And then an intravenous treatment is used later for more dangerous symptoms, like for the nerves and carditis. And here are some of my main sources. Yeah, thank you guys. Bye.